If you were to pick 5 blood tests every year, which 5 would you pick? I'm not talking about the ones your doctor automatically orders, not the ones your insurance pays for without question. I'm talking about the ones that gives the most important information about your health, your risk, your trajectory. I've thought about it, and here's the 5 that I will pick and why. Welcome to OptiLabs, where we decode your lab results and reveal the deeper story behind the numbers. I am Dr. Austin Odigie. Test number 1, the Metabolic Panel with fasting insulin. The standard CMP covers glucose, kidney function, liver enzymes, and electrolytes. It's a broad and useful screen, but I will add something that almost nobody orders automatically: fasting insulin. Together, fasting glucose and fasting insulin tell your current insulin sensitivity with a precision that glucose alone cannot match. You can calculate something called HOMA-IR, which stands for Homeostatic Model Assessment of Insulin Resistance, by multiplying fasting glucose by fasting insulin and divided by 405 if your values are in standard US unit. A score below 1 is excellent. Between 1 and 2 is normal. Above 2 suggests developing insulin resistance. Above 2.9 is a clinical definition of insulin resistance. This combination catches metabolic disease in its earliest stages, years before standard glucose or HbA1c shows anything abnormal. It is one of the most powerful tests available for anyone over 30 or with any risk factors. Test number 2, Advanced Lipid Panel with ApoB. The standard cholesterol panels gives total cholesterol, LDL, HDL, and triglycerides. Very useful, but incomplete. I'll extend that by adding ApoB and ideally LDL particle number or NMR lipoprofile if your insurance covers it. ApoB measures the number of atherogenic artery clogging particles in your blood. It's more predictive of cardiovascular events than LDL cholesterol alone. Many people with a normal LDL actually have a high ApoB, meaning lots of small dense particles. That's a higher risk profile than a normal LDL with a low particle count. Along with ApoB, the triglyceride to HDL ratio remains one of the most clinically useful numbers you can calculate from a standard lipid panel. Do the math yourself. Divide triglycerides by HDL. Under 2 is the target. Why does this test make the top 5? Because cardiovascular disease remains the leading cause of death globally, and most of that risk is measurable in your blood, and most of it modifiable. Test number 3, Thyroid Panel. TSH, free T3, free T4, and antibodies. The thyroid controls your metabolism, your energy, your mood, your temperature regulation, and your cognitive function. A poorly functioning thyroid affects every system in your body. Yet, the standard thyroid test is just TSH. I would include free T3 and free T4 to understand both thyroid production and the active hormone available to tissues. And I also include anti-TPO antibodies, at least initially, to screen for Hashimoto's thyroiditis. For someone who feels well and has no symptoms, a normal TSH might be enough. But for anyone with fatigue, unexplained weight changes, hair loss, cold sensitivity, depression, or brain fog. The full panel is worth running once to establish baseline and rule out thyroid autoimmunity. Test number 4, the inflammation and nutrient panels. This is where I will bundle several markers that are commonly neglected but clinically important. I will add HSCRP for systemic inflammation, homocysteine for cardiovascular and neurological risks, vitamin D, ferritin, and vitamin B12. Together, these 5 markers give you a window into your inflammatory status, your iron stores, your methylation health, and your key nutritional adequacy. They are all modifiable, they are all clinically meaningful, and they are almost never included in the standard annual physical. Low vitamin D, low B12, low ferritin, elevated homocysteine, and elevated HSCRP are all associated with fatigue, cognitive symptoms, and long-term disease risks. Catching and correcting all 5 has meaningful impact on how you feel and on your long-term trajectory. Finally, test number 5, the hormone baseline, tailored by age and sex. Hormones decline with age, and that decline affects energy, muscle mass, bone density, mood, libido, and cardiovascular health. The specific markers depend on age and sex, but the principle remains the same. Know your hormone baseline and track over time. For men over 35, total testosterone, free testosterone, SHBG, and optionally DHEAS. For women, particularly in perimenopause or menopause, estradiol, progesterone, FSH, LH, and DHEAS. For everyone, cortisol in the morning if fatigue or stress response concern exists. You don't need to treat every deviation, but knowing where you are gives you something to compare against if your health changes. A testosterone of 350 in a man at 42 who feels fine is different from the same number in a man who is fatigued, losing muscle, and depressed. Context matters. Having a baseline makes that context possible. These 5 panels together gives you the most comprehensive picture of your health you can get from blood work. But they are not all standard. They are not all automatically covered. But they are all actionable. They all tell you something you can respond to. In the next video, we will look at what tests your doctor typically orders first and what the priority order is when something is clinically concerning.